And this is exactly how they make the yearly flu shot that we all
Right.
hopefully take or should
about that
take.
as well, sure.
But then they match that. But it takes about 4 to 6 months for the drug companies to make the vaccine. They have to grow it in a protein media, and they have to watch it, and it's very complicated. So if the bird flu broke out today and was able to be passed from person to person, it would be about 4 months before the actual vaccine could match the same strain. So we would have to rely on other measures.
Yeah, what are some of the things that people could do, Fran, or back, if you even thinking back to the 68, 69 when a pandemic was out, what are some of the things that folks did then? What are some of the things people do 40 years later today to, are there any projections as to how people would handle it?
Well, basic good health measures is really what we want to teach people. And in the Speakers Bureau, the two of us nurses that work in that bureau and go out and talk to groups, we talk about things that people can do. But most important, first thing, is wash these 10 fingers.
Oh, wow, yeah. If you got 10, wash them, yeah.
Wash whatever you've got.
Right.
The hand washing is really the very best defense, really against almost all kinds of illnesses, but certainly against the flu, because we pass it on a lot of times from my hand to yours. You know, if I stick my hand out to shake yours, you probably shake it.
I'm glad I didn't shake. No, I'm kidding. You're glad I didn't.
Then we touch our face or our nose or eyes, and lo and behold, a couple of days later, we're sick with the flu. So the pandemic flu would be passed on the very same way. So first thing we say is wash those hands.
Right.
And then cover your cough. Have you heard that? Oh, yeah. That's the new campaign. Cover your cough means throw your sleeve up there and cough in your sleeve.
That's right. I noticed some folks have taught my daughter that. It didn't come out of me, but or her mother. It was fascinating to see her recently cough and put her arm up.
So that prevents us from coughing on our hands and then immediately touching someone or the doorknob, and then you come right behind me and touch that doorknob, and boom, you've got those germs on your hands. So those hand washing, cover your cough, and sneeze.
And when we, real quick, Fran, not to jump in, but when we wash our hands, does you need to get really hot water? Do we have to use soap, or is it good water in and of itself take the germs off? Or?
Well, that's a great question. It's the friction on our hands that really kills those germs.
Okay.
We can't quite rub our hands together fast enough to kill those bugs without a little help. So a little bit of soap or alcohol. Alcohol gel is one of the best inventions recently.
So those gels are okay?
They really work.
Wow.
You just have to remember to, we say 15 seconds, sing the happy birthday song or something else. But if you can rub your hands together for 15 seconds, lather up, especially pay attention to the fingertips.
Oh, good.
That's the best thing you can do. So keep a little alcohol gel in your coat pocket, the little travel, and on your desk, and at home in several rooms, and teach your family to use that gel in between hand washing with soap and water.
And to the best of your knowledge, those gels don't do anything negative over time. They don't take off some of your good protective layers or otherwise.
That's a great question, and people are concerned about resistance too.
Right.
But we recommend the alcohol gel. The alcohol gel will not do any harm. It will not create a resistance problem. There are some gels out there that may say antibacterial or made with something other than alcohol.
Right.
Really, the alcohol gels are the best.
Okay.
Even plain rubbing alcohol will work too.
Good. Okay, that may be a funny smell on your hands in the office, but at the same time, the alcohol gels, and this information would also be at coastallscarc.org if someone went there or called your office. Again, if they had to get off right now and couldn't hear the next few minutes, they could still go to your website. There's a lot of great information there.
Yes, absolutely.
Okay. You know, and you stress the pandemic, and this could really, on the avian strain there, currently, has anyone in America been affected? You may have just answered that a minute ago, but...
well, that's a good question, too. No, we haven't had any cases of the avian or bird flu in the United States. We're pretty safe in the United States, actually very safe in terms of our poultry industry, and you can't get it from eating chicken or turkey or any other kind of fowl. So our poultry industry is just top-notch and is safe. But if we traveled to some of the countries where the bird flu was, and we had close contact with birds, meaning very close contact, holding or plucking or whatever, then we could get exposed to the pandemic, to the bird flu, excuse me, in those countries where it is now active.
And what are some of those countries, Fran? Not to cause a scare if someone has a planned trip, but what are some of those countries that people need to be real sensitive about?
Right, Asia, Europe, even some of the Middle East, excuse me, countries. But Indonesia specifically, Vietnam, even Iraq, Iran,
is that right?
Turkey.
That's where the 250 causes or 250 incidences have occurred in those countries.
All in those areas. Hong Kong, Egypt, all in that general area.
Boy, that is very serious. What are they doing? Of course, the World Health Organization, what are some of the things they're doing to get the message across? I mean, they're clearly at a point where they must be promoting this heavy. I guess their Speakers Bureau is probably a pretty pretty big group there.
It is. I think they are trying to educate the people, but in those countries, people live much closer, some of those countries, than we do, and they live very close to their animals. Some people, you know, live almost in the same building with chickens and pigs, and that's necessary for the family to have food to eat on the table. And then the children are right there, play with the birds, play with the pigs, and we pass those germs back and forth, especially flu germs, influenza germs, with those animals. And so it's very difficult to say to a family in Egypt, say, you know, you can't have these birds this close anymore. That may be their evening meal.
Wow.
So it's a lot more difficult than in our situation, where most people here go to the supermarket and purchase their food, and they don't live in the same room with their chickens and ducks and pigs.
That's very important. I'm sure glad you shared that, because that would be of concern to think about. And in that instance, it's while the bird is still alive that it can spread. When it's cooked and ready for meal serving, it can impact the entire family, can it?
That's right.
Okay.
And just as we pass our bugs along to each other by touching or sneezing or coughing, really the birds do too.
Yeah.
The same germs are in the bird's saliva. Also, it's in the bird's gut or intestinal tract, so they can spread it that way. We humans do not spread flu that way.
Right.
So the birds have I guess, a triple way of spreading that bug, and then people that handle the bird, you can't really keep from touching the beak and touching other parts of the bird that might be infected when you're preparing it for the meal. But once it's on the table, those germs are gone. So
no real worry after it gets there, but clearly a lot of worries in those settings where the people are living in such close contact to the birds there and other animals. And I guess the health organization is not yet sure if it goes beyond birds, or are they positive that it can only, are they worried that it can go to other animals?
Oh, yes, the bird flu can infect other animals. In fact, one of the earlier cases of deaths was in Thailand, in a lion and a tiger who
is that right?
were fed raw chicken or raw fowl of some kind, and were dead a couple of days later in their cages.
Is that right?
So other animals can be infected with the bird flu.
It is fascinating how medicine can get that so quickly that after a couple of days they could figure out this tiger has died. I'm sure it took a little bit of time to figure it out, but to take it all the way back to something they ate, it's incredible how medicine works.
It is. It's wonderful, isn't it?
It is. It is wonderful. It reminds us of higher beings, of course, of a special. We think about germs ourselves. How long can the flu germ stay on our hands, Fran? If interacting with adults or children or otherwise, how long should we be concerned about?
Well, of course, immediately after contamination with a sneeze or a cough, or even like cleaning a child's nose or mouth, the bugs are much more active. Over time, of course, they're going to die. And then things that affect the death of those bugs would be heat and friction from rubbing and the alcohol, those kinds of things. Certainly, those germs are gone within days. We're not really sure exactly how long, But minutes and hours, yes, they're still alive and well. And our hands are a great breeding ground for those germs. They're moist, and they're touching a lot of different things. So, boy, that's why hand washing is just so important, so very important.
I'm sure glad you shared those the simple aspects there, Fran. Thank you so much for coming in to be with us this morning.
Thank you for having me.
Absolutely. Stay tuned to more Carolina People with Fran Long coming up next. Isn't it apropos to be in a wellness and fitness center when we're thinking about issues that can impact us? Our daily lives. You heard Fran talking about it, how special it was seeing that cousin wearing the white dress and the white hat, wanting to be just like her. But it wasn't just to wear a white dress and a white hat. It was to care for others, to make a difference in their lives, from youth of all ages to adults of all ages, constantly recognizing their needs we have. It can be as simple as giving a handshake or touching your eye and then touching someone else. The flu can spread, and the pandemic flu. A pandemic flu could actually spread and impact not only the 250 folks that the pandemic's affected up to now, infected, but many, many, many more, many millions of people. Think about it. You can make a difference by going online to coastalscarc.org and just being brought up to date with the issues, or you can pick up the phone and call 843-477-0020. Making a difference. You heard her say it.